So what can you do after cataract surgery, and specifically what should you avoid? Most people will be able to assume almost all normal household activities, such as cooking or walking around the house, a day after the operation. The eye is certainly comfortable enough to allow them to do that. Within a week, normal activities such as walking outdoors, anything that's not too strenuous, including yoga, is absolutely acceptable. There's a myth that you can't bend or lift following cataract surgery, and I really want to emphasize that is a myth. It is safe to bend, it is safe to lift gentle things. The only problem with bending is that once you've had one eye operated on, the brain does get a little bit confused on judging distances. So I would ask you to bend very cautiously and make sure that you don't hit the operated eye against any objects nearby. Activities such as reading, watching TV are perfectly acceptable from the word go. The eye will not get damaged by doing anything like that. One of the embarrassing questions people ask me about is when can we return to sex? And it is usually safe to do so within about 2 or 3 days of surgery. It's important to maintain absolute hygiene at all times. So another question that patients ask me about is when can they drive? The DVLA does allow driving if you can see a license plate at 20.5 meters or read up to 612 on a standard chart, and most patients will be able to do that. 95% of patients will be able to do that unaided following surgery. There's no clear timeline on when that is the case. It is really up to the patient to judge that their vision is safe within those parameters to do so, and certainly at your consultation I'll be able to guide you on that as well. In terms of what should be avoided, there isn't a lot that could damage the eye. The most important aspect is that you don't contaminate the eye, because that would put the eye at risk of infection. So it's perfectly all right to shower, but if possible, keep dirty water flowing away from the eye. Some of my patients choose to have their first hair wash at a hairdresser's, and that's quite a nice pampering experience. Avoid swimming for 2 weeks, because even though the water's chlorinated, it can be a source of infection. I would ask patients to avoid activities such as gardening in the first week, in case they accidentally rub soil into their eyes. Apart from that, there are no major restrictions.